Plastic surgery myths. Let's talk about it. So despite the increasing popularity of plastic surgery in the last few decades, we are still seeing that there are a lot of plastic surgery myths out there and a lot of, dare I say, unreasonable expectations of plastic surgery and plastic surgeons. So without further ado, let's bust the top 10 plus 1 plastic surgery myths that are out there in the world causing a ruckus. Number 10, plastic surgery is only for the rich. Now that, hopefully I've discussed a lot in earlier videos about how plastic surgery has become increasingly more accessible for people who have smaller wallets. And so it's not only for the rich. I will say that affordable plastic surgery doesn't always equate to good plastic surgery. So there is that conversation that still needs to be had about how we value plastic surgery and still get a relatively cost-effective but safe alternative to the high-priced heroes. So plastic surgery is available for everyone. You can finance it, you can pay for it outright. There's so many different options. The one option that I caution people about, and I've cautioned you guys about too, is don't just think that going to another country where cost of living is less means that you will save a lot of money in terms of your plastic surgery. Again, you get what you pay for. So if you pay $1 for surgery, think about what you're doing before you do it. It's your body. Number 9, plastic surgery always leads to an unnatural look. You can always tell when someone has had surgery. Not true. Not true at all. The best surgeons know that good plastic surgery is a surgery that you can't even identify. There has been a lot of unnatural looking body parts. From lips to cheeks to butts to breasts, we have had a lot of exaggerated looks in the past decade or two. But hopefully as we move into 2025, we're moving into an era where people are appreciating that natural beauty can be achieved with plastic surgery, and that it should be the goal. Number 8, plastic surgery equals cosmetic surgery. As a reconstructive surgeon who also does cosmetic or aesthetic surgery, I take issue with this. I myself in medical school even thought that plastic surgery just meant nip, tuck, and botched, right? But actually, the larger component of plastic surgery is the reconstructive portion, where we're taking people that have been suffering from trauma, cancer, congenital differences, to give a new life where life previously was pretty difficult. So my favorite thing is to say that plastic surgery may not be always life-saving, but it is life-giving. So no, cosmetic or aesthetic surgery is just one piece of plastic surgery, but not the whole pie. Number 7, results are permanent. We all are getting older. We are all getting older, and even if you've had plastic surgery in the last 2 years, your results will continue to change as you age. Things may sag where they didn't sag before. And remember, the heavier they are, the harder they must fall. for all those of you getting giant BBLs and giant breasts. So things will change. Results are not permanent. They are subject to change as we age and as we change. Lifestyles, things like that. But here are some things that you can do to avoid drastic changes, and you can use to uphold and upkeep your results for as long as possible. Lots of sunscreen. Invest in a great sunscreen with at least SPF 30. Sun damage is the #1 leading cause of aging, facial aging especially. And it's also a cause for skin cancer. Avoid smoking, avoid drinking alcohol. Work out, and avoid significant changes in weight. With these 5 things, you will be able to maintain a youthful appearance, keep up your plastic surgery results for as long as possible, but still remember that your results will change as time changes. Number 6, cosmetic surgeons equal plastic surgeons. So just like cosmetic surgery is just a piece of the whole puzzle, people who do cosmetic surgery are a piece of the whole puzzle. Now, beware of surgeons who claim to be cosmetic surgeons, but they haven't done the prerequisite training equal to plastic surgeons. What I mean is that there are a lot of people out there purporting to be cosmetic surgeons. But the truth of the matter is that to be a truly certified cosmetic surgeon who's also a plastic surgeon, you need to have gone to med school, been accepted in, and fulfill a 3 to 6 year training program in plastic surgery. They then have to have been board certified, in America at least, by the American Board of Plastic Surgery. People who say they are cosmetic surgeons, you need to look for this. If they say they're cosmetic surgeons, but cannot back that up with plastic surgery training, I would be very careful of what actually they are qualified and trained to do. Just because a person can take out your colon because he's a general surgeon does not mean that he can also do your tummy tuck, okay? And so training is very important. It's very important. And without it, you can have very dangerous results. You can have just bad results. So please be careful, do your homework, and make sure you're getting a truly board certified plastic surgeon to do your work. Number 5, non-invasive procedures yield the same results as actual surgery. So there are a lot of things that we can do with non-invasives, from Botox, filler, lasers, light therapy, chemical peels, you name it, we have it. And there are even things that we can do that are non-invasive for things like skin tightening. But do not mistake that at a certain point, if your skin is falling off of you, all jokes aside, that cannot be fixed with a laser. That needs surgery. And so a good surgeon will tell you there are levels to this, right? And we can do a little bit of laser to get this up and suck and tuck a little bit of extra. But when there's too much excess skin or too much excess fat, you cannot avoid the need for surgery. If you want the result that you want. If you're okay with what could be a minimal result, then by all means, spend the money on the non-invasive procedure. But remember, sometimes non-invasive also means more expensive with not the same guarantee for result. So also a thing to think about. Number 4, plastic surgery is without risks and the results are guaranteed. Nope, as my husband would say. No, plastic surgery has risks. And the question for you and your surgeon is, are the risks outweighed by the potential benefits? Furthermore, no one can guarantee your results. They can only guarantee that the work has been done, but it may not exactly be what you expected. And so we always need to also manage our expectations, because plastic surgery requires your body healing, and at the end of the day, your body will determine the result with a little bit of help from the plastic surgeon. Number 3, people die from plastic surgery. That actually isn't a myth. People do die from plastic surgery. However, let's break down why deaths happen, specifically in the cosmetic surgery realm. Typically, people are dying from things like BBLs because of trying to save a lot of money on the surgery and the surgeon. So picking someone who is less than qualified or unqualified, frankly, to do the procedure that they're discussing with you. And 2, not having a surgeon who also is managing your risks and doing the calculations in their head about how to minimize risk while maximizing the results. If someone offered you a breast augmentation under local, these are the kinds of things you have to think about and talk with your surgeon about. How are you going to make sure that I'm alive and I stay alive during the procedure if you just give me local anesthesia? While it is uncommon for patients to die from cosmetic surgery, that does not mean that people do not die. It just means that you need to pick a surgeon who is a physician first and not just a person trying to get money first. A physician first will consider you individually as a patient and will manage and calculate as a whole if you are a good candidate for the surgery. And they will also calculate and figure out and manage the risks of the surgery itself to make sure that they are doing everything as safely as they can while maximizing your result in the end. Number 2, good plastic surgeons leave no scars. That is a complete lie. What really is true is that good plastic surgeons leave tons of scars, but they do it in a way that minimizes trauma to the tissue so that you heal as well as you can for a thin, fine line of a scar. And so remember that plastic surgery is always going to be a trade-off of moving something, shifting something, decreasing something, what have you, for a scar. The question is, how well does your surgeon leave scars? But it is not fair to expect that your surgery will come with no scars. Number 1A. Liposuction is a good means for weight loss. Absolutely not. Liposuction is never a substitute for doing the work. It's never a substitute for losing weight with medication, bariatric surgery, diet, and fitness. Never a substitute. What liposuction can do is get rid of stubborn pockets of fat that you just aren't seeing disappearing when you do the work. But never, 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 never think that liposuction can be on the front line of weight loss. It is not. I cheated. So here's the real number 1 myth of plastic surgery. If I get plastic surgery, I will look like Kim K, Kelly Rowland, Beyonce. But here's the deal. Even if you get the same surgeon who did Kimberly's, your result will be your individual result. It depends on your body shape to begin with, your lifestyle to begin with, how you heal. All of these things are factors in what your result will be. A patient asked me the other day, why is it that whenever I look at befores and afters on plastic surgeons' Instagrams, all I see are boxy figures? I don't see really curvaceous people getting tummy tucks. There can be a lot of reasons why people look like SpongeBob SquarePants in a lot of plastic surgeons' befores and afters. But one of the big things that you have to consider is, how was she built before? We're not going to magically change the shape of a woman with a tummy tuck. If she had a more athletic figure before, then she will still maintain a more athletic figure. Now, body contouring has changed that paradigm a little bit, but the same holds true for anything that you can think of. Individual results will vary. So those are the top 10 plastic surgery myths. Which did you believe in before this discussion? Leave your comments and your questions below. Like and subscribe. And as always, love you lots and bye for now.